So we're live.
It's thinking again.
Hey everyone, happy Thursday.
We're live.
Yeah, I
in
think
person.
we're live. I think we got to work. Sorry for that delay there. We were hoping to start at 5:30, but President was talking about the economy today, so I think there was some
People are streaming the Tiger King.
or the Tiger
Tiger
King. As you can see, we've been very busy.
It's not good.
Well, to change subjects, we'll switch over to Levon, and he's going to give us some stats for today.
So, yeah.
Thursday.
I'll share with you guys the stats for today. We have 6 new positives today, so that's a slight stair step down in the average run rate. One day does not make a trend, so we'll have to wait and see what the 3-day average is. I hope that is a sign or a moniker of a little bit of a slowdown. But that brings us to 178 total positives today since we've been doing this, and that's out of 1,758 tests, so right at 10% test positive. So we'll see where that goes. We're cautiously optimistic. We're watching the situation over in Mobile. There's more cases proliferating over there, but nationally it does seem like there's a little bit of slowdown. Obviously the efforts of people being careful seem to be helping. I'll mention 2 other things real quick. People ask, are we too close together? And we say 6 feet, but a meter is you're good. A meter is 3.37 feet, and technically from that distance, based on the science, you're okay. 6 feet is just easier to remember. And the other thing, we've gotten some questions again about the masks, and again, we can't emphasize this enough. Basically, the Surgeon General sort of caved in a way because you couldn't get people who were sick to wear the mask. That's the ones that need to wear the mask. A person who's coughing is the person who most critically needs to wear a mask. Actually, the best bet is if you're coughing, stay away from other people. If you hear someone coughing, they need to immediately put a mask on and get away from everybody else. We actually have a case where we had somebody who was wearing a mask in their house and said, well, I was wearing a mask. They actually contaminated the mask and caused themselves to get COVID. A mask will not save you. It will keep a person who has COVID-19 wearing a mask might not cough on somebody. It might stop them. And then if you're a medical professional, as Tiffany demonstrated, the proper way to wear those. So anyway, enough on the masks. We'll talk more about those later, I'm sure. The last thing I'll share with you guys before I get out of here, I'm going to go take a call and leave Sarah to talk to you. Hopefully she's got some harder questions than you asked Dr. Barber. But anyway, last thing I'll leave you with, today we started something. We are down to 9 inpatients remaining. We were able to discharge another person at home today. Very excited about that, and in keeping with our Singing River branded theme, now when we are able to send a person home that had been COVID positive, we play the song Don't Stop Believing. So I'll send an email to our team to let them know that's why we're playing a clip of that, just like we do when a baby is born. It's something we want to celebrate when a person gets to go home. So don't stop believing. I'm going to step out and leave you guys. Appreciate it. Have fun.
Thank you, Lee, for that positivity. So now we'll get to the tough questions here with Dr. Roth. You've been on the front lines, working side by side in the trenches with the men and women in the ICUs, and on the floors and the ERs. So tell us, what exactly, is the message that you have for people?
Message for our patients is the best way to not be in the hospital is to stay home and not get the disease. So isolate, social distance, do everything you can to limit your exposures. Once they're in the hospital, usually one of 2 things happens. If they're otherwise healthy or maybe 1 or 2 comorbids, they can get better and go home. We've sent 25 or 30 folks from our floors home. Unfortunately, about 2 or 3% of these folks get really sick and they end up in the ICU, and the ICU is a scary place. Everybody's in full PPE. We've got N95 masks on. All of our equipment's outside the door. It can be an overwhelming place. It also can be overwhelming for our patients because they're by themselves. There's no visitor policy. It's the right thing, but it's patients feel alone and they're sad. So, my ask of what I tell our patients, that are not on the ventilator is you can get better, do these things. When you go home, still isolate until you're clear. We've yet to have a patient that can get off the ventilator yet that's COVID positive, and hopefully we're going to have a couple of those pretty soon. But I think the patients being alone and then the families not being able to see their loved ones. Today, a cool thing, my nurse Sylvia got totally PP'd up and did a FaceTime with one of our ventilator patients and her husband. That was pretty
That's
cool.
amazing.
And I think that the lady on the vent was smiling and squeezing our hands. So we're doing some pretty good stuff.
Yeah, so we're doing the best we can to make this experience as comfortable and as inviting as we possibly can, even though the patients in these rooms who are in the ICU on life support, what is happening in their body? Like, why is this disease so, malicious?
I've said this numerous, this virus preys on folks who are underlying sick. End-stage renal disease, dialysis patients, the elderly, diabetes, obesity, hypertension. And those folks are like a basketball team that doesn't have anybody on the bench. There's 5 players and there's no reserve capacity. You're not going to see, or we have not seen someone, a Tiger Woods or some really, really healthy type of person get this disease. And once you get over the pulmonary aspects of the disease, then you'll have to deal with everything else, the myopathy, the weakness, possible blood thickening and clots, and stage renal disease because their blood pressure is low for so long. So we see a lot of the downstream effect of this disease at about hospital day 8 to hospital day 15. We can clear the lungs on occasion, but then we're left to deal with everything else.
Right, because Dr. Wilson, our in-house pulmonologist that we have here, he kind of explained to us that it's an advanced art.
That's right. So acute adult respiratory distress syndrome, the lungs get very stiff, and it requires high ventilation pressures to get their oxygen levels up, and the lungs can get damaged from that. While they do this, they also a lot of times become hypothermic. They're running low temperatures, low heart rates, or low blood pressure, and the kidneys are getting squeezed up, and then you end up with elevated creatinines and maybe even need some renal replacement therapy. And then by that time, it's just a continual negative chain of events, which is hard to reverse.
Makes sense, one thing after the other. Speaking of Dr. Wilson, how has he stepped up throughout this whole process?
I love Mike. Mike's military trained, and he only has 2 or 3 days off a month, and he had his days off for the first COVID patients we had. And he called me and said, "I'm coming to work tomorrow morning, like it or not. I've trained my whole life to do this, and let's go." And he's been brought a lot of experience to our critical care team. Him and Dr. Bob have worked hand in hand. He's done a good job for us.
Yes, they are excellent people to be taking care of the sickest of the sick, especially those who are in our ICUs. We're trying to pick up information and work with our partners in other health systems that are a little bit larger than us in bigger cities with more resources. What are some of the entities that we've worked with to provide the most high quality care along with our team for these patients?
Sure. So I talk to the equivalent of their CMOs in other hospitals every day. I talk to the folks at Ochsner who are our colleagues and friends to the west. I talk to our friends at South Alabama to the east, and my good friend at UAB, infectious disease physician. And I'm pretty happy to say that we're doing pretty much everything they've done. We're isolating our folks to one or two units, to one system, to one hospital. They're doing a lot of PPP education. So we talk about our regimens and our drug treatment, and they're doing the same thing we're doing, just on a much larger scale. Like to give you an idea, today I talked to Ochsner's director of critical care. They had 96 on the ventilator. We got 7.
Right.
So they just have bigger numbers, but we're seeing the same thing. The same CT findings, the same X-ray findings, the same blood pattern. It's a pretty consistent disease, and you get better at taking care of them the more you see.
Right, that makes complete sense. Speaking of teamwork, talk about some of the inspiring moments that you've had. Not all doom and gloom, but there is some hope here.
So, a lot of the things that I've seen, just people stepping up and saying, "I'm okay to work in the COVID unit." Dr. Wilson saying, "I'm in." Dr. Dipti Baral saying, "I'm in." Dr. Bobber saying, "I'm in." One of our, sometimes out of badness comes great things. And we had a patient that we extubated end of life, and his or her spouse did not want to see them like this. And we promised her or him that they would not die alone. And our ICU nurse donned up in full PPE and went and sat by that patient's bedside and held their gloved hands until he passed. And I have a picture of her from the backside, and it's pretty moving.
Wow, we really are trying our best to serve with heart and soul and to make sure that everybody's, going about this in a very dignified way.
You got to do it. I mean, I'm doing these family meetings 4 times a week where I'm getting our families in one room, and they've signed a release form for privacy, and we just go over and over. And I'm spending more time with them than I'm spending at my house. And, when you get to a point of futility of care, end of life, and a lot of families, not a lot, but a couple have decided that, mom wouldn't have wanted this to be prolonged or dad wouldn't have wanted this. We're able to make them very comfortable at the end of life. We bring their family, one member, in the room after we do an extubation so they can be at their side. And there's such a thing that Dr. Weldon's always said of a beautiful death. And we're trying to, the few that we've had, we're trying to provide that.
Right, that's kind of what we do. So with that, the nurses, how are they holding up? They're the ones with the patients 24/7?
I'm the most proud of our nursing staff. And I'm only on these floors an hour to 2 hours a day, seeing my patients for 5, 10, 20 minutes at a time. These folks are doing 8, 12-hour shifts. Our IC nurses have stepped up. They've done unbelievable bedside work. They'll be able to tell their kids and their grandkids that they are the heroes in this. They are the ones that are really out front with the most exposure, and they step up to the plate. We're not lacking for staff. I'm proud of you guys.
Absolutely. Thank you guys for everything that you're doing, the long hours, the teamwork, the effort that you're putting in to make sure
Our
that we
respiratory
provide everybody.
therapists, they need a shout out too.
All the frontliners.
Those guys and ladies are in there removing tubes and changing the ventilator settings. And so a lot of these patients we have, and our nurses and nurses' aides, these patients you've probably heard, a lot of them need to be proned. That means when they actually are on the ventilator, they need to lay on their stomach as opposed to lay on their back. It improves their oxygenation and aeration. Well, some of these patients require 3 or 4 or 5 people in the room to get them prone because they're paralyzed and sedated. And it's not unusual for me to go to the ICU and see 4 people turning a 220-pound patient to be prone to get a better chance of oxygenating. And they're the real heroes in this.
Right. Doing what it takes, doing everything they, were trained to do. It sounds just completely astonishing. We have some residents here we've recently taken in from our military partners. Tell us about some of the people that have stepped up who are trying to learn as best as they can.
So we've had a relationship with Keesler for a year or two where they send their residents to have their internal medicine and hospitals experience with us. But it was pretty heartwarming when this broke. One of their residents, his name is Nemo, we call him Nemo.
Finding Nemo.
He pretty much said, I want to say 30 straight days. I want to see everything. He was a medic before he went to medical school. And in the military, they train for, obviously, mass casualties and things like that. And Nemo's been there every day, 7 o'clock, leaves at 5 or 6 o'clock, on the front line, seeing these patients, helping us with procedures, and bringing a little military finesse to and they were here today visiting the Keesler folks, and we showed them around in our units. He's done a great job. All of our Keesler guys, they're heroes too, both for serving the country and for helping us from the front line with this.
Yeah, it's all hands on deck here. Excellent. And I guess we'll end with a positive note. Who is there any patients that stick out of mind that have gone home that have maybe not had the best journey?
That have had a good journey?
Mm-hmm.
Yeah, we've, I'll tell you a great kind of story. We had a good friend of mine who lives on my neck of the woods who was diagnosed positive, came in with pretty abnormal chest x-ray and a couple of comorbids, and he looked at me and said, man, I trust you. What do you want me to do? And I said, well, if you can wear oxygen at home, why don't you just go home? You got great family support. And yesterday when I was jogging late in the afternoon, he was on his front porch back to normal 8 days later. Great victory, and we'll retest him down the road and get him back to doing what he was doing. We have sent a lot of patients home. We sent one lady home from the ICU who was on 100% oxygen, and we did not have to intubate this patient. And we sent her home on Monday this week. So we're seeing some victories. We're going to hear some Don't Stop Believing every couple hours, I hope. We're holding out. Right now we're talking about how we're going to take care of our chronically ill patients on the ventilator. Will they need tracheostomies, and how we do that to keep our employees and our anesthesiologists safe, and we're working on that plan now.
Excellent. Yeah, so every day is a new learning curve, a different experience, but I think that we're going to have more positive numbers than the ones that aren't so lucky with this disease. So thank you, Dr. Roth, for joining us today. And as everyone knows, stay singing River Strong. Thank you.
Amen.
That's a wrap. Thank you, Dr. Roth.
Thank you.